Erin Bickle. So I'm the executive director at a nonprofit located here in Madison County called Refuge. We serve children, small children, really early childhood through elementary age is our target age kids. And we serve them by providing free counseling and caregiver support services to children who have lived with or are living with traumas such as domestic violence, physical, sexual abuse, neglect, addiction in their home, poverty, community violence, what we call complex traumas. Not typically your one and done, though those are two, a death, a divorce, those types of things, but traumas that continue a lot of times in these children's life until someone intervenes. And so we have the privilege of serving those kids. We're located out of Riverbend Family Ministries in Wood River. There's 10 nonprofits that are housed there, and we are one of them. So it's fabulous because though we're a smaller agency, we feel like we're part of a big family because there's so many wonderful organizations there.
Tammy was one of our speakers.
Yeah,
So
most of you know Tammy Harris. So back in 2014, our community lost a program called Safe from the Start. It was funded through the state, and it was a violence prevention grant for our smallest children, birth to 5. When we lost that grant, I had previously worked for that program, but Tammy Ascaris said, we can't go without these services. There's nobody else providing this work to these kids. And so Riverbend Family Ministries launched a community needs assessment to really take a look at gaps in services in our community. And this was a huge gap because we have many children who live with trauma and many children who were getting served through the Safe from the Start program that when it got shut down, it was abrupt and there was really nowhere to refer them to. So Riverbend Family Ministries launched the program, and Tammy called me and said, hey, I need you to come run this program. And I said, hey, that's great. How is it going to be funded? I'm not a fundraiser. And so we thought perhaps that we would be able to get the Safe from the Start grant back. I had written it before previously, but through a different umbrella because the agency that had it was not going to be able to get it back. So thus launched Refuge. RFM raised a lot of money in a short amount of time to bring on 2 of the Safe from the Start staff. And then I came on a little bit later, a few months later, to kind of oversee and run the program. And so we have been serving children since 2015. And we're a community funded program. We are funded locally. We're funded by individual donors, monthly partners, businesses, local grants. And what I found, though I'm not a fundraiser, though I wasn't a fundraiser, I guess I kind of am today.
Aren't we all?
I found that we live in just the most generous community. If people are given the opportunity to learn about a need and they're able to help meet that, they step up and do that. And so we have experienced tremendous growth. In 2015, there were 2.5 of us. And today there are 12 of us and 7 interns. And so we have grown, and just last month in March, we served close to 300 children in our therapy program and 340 caregivers who are safely caring for those children. So we are very busy. There is a great need right here in Madison County, and this is our demographic. These are the kids that we're serving, kids right here in Madison County. There's a great need for our youngest kids to have services. That's about trauma and just child abuse. Not to be Debbie Downer, I'm going to follow it up with what we call protective factors, but April is Prevent Child Abuse Month. And I'm a huge proponent that a community can prevent child abuse. Child abuse is 100% preventable, but it takes all of us. It takes every one of us in this room to help work to prevent it. Some facts about child abuse. Most often, the abuser is someone the child knows, such as a parent, a relative, a neighbor, a family, a friend, a trusted adult like a mentor or coach, unfortunately. Stranger danger is not typically where we see harm coming from. It's typically someone that child knows. Each year, close to 3 million reports of suspected child abuse are filed in the United States, and we know many more never get reported. And one victim of child abuse is too many. I know Gene works at Head Start and sees, these babies. Many of you probably do too. Probably all think of a child that we know that has been violated in some way, and it's horrific and it's horrible. One victim is too many. Madison County, unfortunately, we are one of the top 10 largest counties in our state. And we are ranked number 2 for the highest number of children in foster care. And our neighbor, St. Clair County, is number 1. And to give you some idea, Cook County, Chicagoland, is number 8. What's not a proud statistic, but here's what I want to say about it. I often think, how, why, what I think, there are children abused everywhere in every county, and many of them go unnoticed. So I like to tell myself, we have a lot of eyes and ears on kids in this community. And I hope that it's because our mandated reporters and our non-mandated reporters are making calls and are looking out for the well-being of children. But the sad fact is that we're ranked number 2. Illinois is number 6 for highest number of child deaths at the hands of abuse. As of 2021, Texas leads as number 1, but we're number 6. A new report by an inspector general for the Illinois Department of Children and Family Services showed that 171 children died while in contact with DCFS last year, 40% more than the previous year. We had a 40% increase, and we're seeing it right here in Southern Illinois. Even now, our child deaths are up. Some of them, a lot of them are abuse. A lot of them are unsafe sleep. Our parents co-sleeping with babies. And we have a lot of education to do because that is 100% preventable. And nobody lays down with their baby or their newborn with the expectation to kill their child. But the sad fact of the matter is it's happening. And we've seen several child deaths in Southern Illinois just in the last month. It's not enough, though, to know about the prevalence of child abuse and trauma. We also need to understand the kind of efforts that will prevent it from happening in the first place. We have to, as a community, build protective factors in that strengthen families. We have to add, Gene, I'm glad you're here because I was going to plug you guys. We have to advocate for and promote programming that put children in safety first. That put children and child safety first, like home visiting programs. Head Start has a fabulous home visiting program. Refuge, we do home-based counseling. That early intervention programming that's coming in at the youngest age, again, Head Start, early childhood programs that are focusing on counseling. Because what we know for a fact that science backs is the earlier we intervene in a child's life where there is trauma, the better off they will be later on in adulthood. We know that adverse child experiences, even in utero, even as newborns, even as 1, 2, and 3, have the greatest impact on a child because it impacts their healthy development, which then impacts every stage of development that follows. And so it is a myth to believe that a baby is not impacted by domestic violence in a home. It is a myth to believe that a baby is not impacted by a severely depressed mom who is, quite frankly, not able to meet that child's emotional needs or physical needs a lot of times. So we must promote and talk about and work together as a community, like you guys are doing here, bringing in programming that educates and helps make you aware. If you're not sure how to put ideas into action, or if the idea of child abuse seems too overwhelming, I understand it is overwhelming, but I just want to suggest this: take action by being a stable, caring, consistent adult in a child's life. Show up in their life. Let them know that they are loved. Let them know that they are seen. If you are a mom, a dad, a grandma, a grandpa, an aunt, an uncle, a coach, I often tell people, if you coach a sport for children in park and rec, or even on these select teams that people pay big money for, there is child abuse going on. There is addiction in a lot of those homes. There is dysfunction and destruction, just like there is in the homes of children living in poverty. And so if you are a coach of a sports team, or you know a coach, man, you have a platform to help change a child's entire life. And so think about that. The most crucial protective factor for a child is that they know at least one adult in their life cares about them, helps guide them, and helps them learn how to be a child, helps them learn how to grow and how to believe in themselves and how to surround themselves with positive people. It takes one, research tells us, one loving adult to change the trajectory of a child's entire life. And so I often think, yes, myself and my program get the privilege of being on the front lines of families' most horrendous experiences and a child's most vulnerable time whenever they have shared that they've been violated in some way. We get the privilege of sitting with them and helping them learn how to heal, but that isn't the whole picture. That is one little slice of the pie. The community relationships that they have, the baseball teams that they play on, the Boys and Girls Club that they go to after school, the YWCA, whatever it is, their daycare programs, their summer camps that people volunteer at, that work at, we get to play a big role in their lives. And so while April is Prevent Child Abuse Awareness Month, I just like to speak to our community about this important topic, because one loving adult is a protective factor that will change the outcome of a child's life. And it doesn't take a lot to help a child feel loved and seen. It really doesn't. And so we all have that opportunity. And so I would be remiss to ever talk to groups in April without really talking about the prevention side of what we can do. And then, as I shared a little bit about Refuge, and I'll wrap up, just know that we're here to offer hope and healing and restoration to these children. And a lot of the children that we see, they may more than likely be in counseling off and on for a lot of years. A lot of them have been violated in the most awful way. And the very people who are put on this earth to care for them, to teach them how to trust, have breached that, have not shown up for them. And a lot of times that takes a lifetime to heal from. That takes a long time to process through and accept. And a lot of times, it doesn't come until adulthood acceptance. And sometimes that doesn't even happen. And so I often tell people, whenever I get asked, you see these kids and you guys get to do this, but then what happens if they go right back into a home? They get taken away and then they get returned and then you don't get to see them anymore. And I say, well, I hope and I pray that this program and our facility and our therapists and our services that we provide have allowed them to feel loved and heard and cared for, and put a really good taste in their mouth about mental health services, about counseling. Because if we can start breaking stigma at a young age about it's okay to not be okay, and it's okay to ask people to come alongside of us and help us, then, I mean, we've done a lot. Because I can tell you that in this room of adults, 1 out of 3 of us have been impacted by childhood trauma. And there's probably some in this room that have never had treatment, have never got counseling, have never talked about it. And that's, there's a lot of reasons for that, but stigma is a huge one. And so I feel like the younger we can help kids have a safe place to heal and talk, the better off we are. And the unfortunate piece about mental health services in our nation is that our youngest population that we know are the most vulnerable, that we know the outcomes if we can intervene are so much greater. There's no reimbursement for services. Insurance companies will not pay for children typically under 6 to have services. And so any service, any mental health service that is being provided to our smallest children is being provided through community, through prevention grants, through those avenues. And so that's my soapbox for legislation and like, let's get things changed. But, and I hope I see it in my lifetime, but in the meantime, there's a lot of work to do. And myself, my team, and many other wonderful agencies in this community are working together to try to bring some hope and healing to our kids. And so thank you for letting me come and share.